Ensuring overall well-being during cancer treatment involves more than just addressing the illness itself. Wellness strategies are key, but do they really optimize the health of cancer survivors? I'm getting to the bottom of it with a respected oncologist in this Patient Empowerment Network Restore program. Dr. Comander, what are some of the most effective wellness strategies you recommend for patients to incorporate during cancer treatment to support their overall well-being?
I'm really excited that over the past few years, we're seeing more and more research demonstrating the important role of lifestyle interventions in terms of improving our patients' outcome after a diagnosis of cancer. So I'm a breast oncologist, and of course, there's so much data in the field of breast oncology, but now we're seeing so much data emerging with regard to individuals with prostate cancer or gynecologic cancers or hematologic malignancies such as multiple myeloma. So this is really an exciting time to be paying close attention to this field. So when you say what are some of the most effective strategies, I have to pick my favorite: exercise. This field of exercise oncology is really exciting, demonstrating that individuals who are able to engage in physical activity after their cancer diagnosis have improved quality of life, reduce cancer-related fatigue, and in many cases improve outcome. And a lot of this data has certainly come from the field of breast oncology, but again, we are seeing it more and more in other types of cancers as well. In terms of other wellness strategies, we've talked a lot about the important role of nutrition and thinking about some of those key concepts of what we consider an overall healthy diet, a predominance of fruits and vegetables, whole grains, limiting red meat, avoiding processed foods, and avoiding, sugar sweetened beverages and alcohol. So that's kind of all part of a healthy diet that we think about. But more and more research is also demonstrating that diet can actually potentially influence outcome as well. And, there's a lot of research trying to understand the mechanisms of this. And I think if your listeners are wondering what's an area where I can read more about this, I feel like the gut microbiome, learning more about that is really interesting. We know, for example, in the field of multiple myeloma research or in the field of looking at immunotherapy drugs, a healthy, diverse gut microbiome, meaning those bacteria in your GI tract have favorable characteristics and they're very diverse and healthy. That is a reflection of the diet. Lots of healthy fruits and vegetables, fiber in the diet helps result in a healthy, diverse gut microbiome, which in emerging studies is showing that that is associated with improved responsiveness to certain drugs, particularly immunotherapy. So this is an exciting time. The field is evolving, but I'm excited to learn more as we continue to see these studies emerge.
Thank you. And Dr. Comander, how do you see lifestyle medicine contributing to optimizing the health of cancer survivors, particularly in reducing late effects and improving overall well-being?
So I'm a strong advocate that these tools from lifestyle medicine should be a part of every patient's cancer treatment. And these are pretty basic things when we think about, again, physical activity, encouraging exercise, following a healthy diet pattern, getting adequate sleep, social connection. Actually, let's talk about social connection. I feel like that's one, when I first started getting to this field, I'm kind of like, yeah, social connection, that's important. But I will tell you, as I've been doing this more and more and working with groups of patients, focusing on providing education about diet and exercise and stress management and sleep and all of these important things that we've been talking about, I've noticed that the support from other individuals who truly get it, if you bring a group of patients together who are all going through treatment for multiple myeloma or prostate cancer or breast cancer or whatever it may be, that support piece, talking to another person who's facing the same challenge, who might want to meet you at the YMCA and go to that exercise class, or might be willing to text you, hey, how are you doing with those salads you're trying to have for lunch each day? That accountability and support is such an important component of health. And I think we really learned during the pandemic how much social connection and support is so integral to our health. So I think in the field of oncology, the work this organization does and so many others, that building of community, social connection, social support is really something we should invest more in to help improve the health and well-being of our patients with cancer.
Absolutely agree. Thank you. You heard it here from Dr. Amy Comander. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.